All right. Good evening, everyone, and welcome to another enlightening and educative session as we continue marking the 2021 Breastfeeding Week. My name is Angela Okomadu, and I will be your host for this session. Remember, the theme for the Breastfeeding Week is Protect Breastfeeding, a shared responsibility. Yes, breastfeeding concerns everyone: father, mother, grandparents, aunties, and uncles, not just the mother with the breasts, right? And today, the topic is demonstration breastfeeding and lactating difficulties. And our speaker is Rosemary Iwe. Welcome, welcome, welcome to the show. So
Thank
I'll
you
tell
very
you,
much.
I would like to tell you a little bit about who we have here today. She is a registered nurse. She's a midwife. She's a pediatric nurse. And she's also a lactation specialist and consultant with so many years of experience of helping mothers succeed in their breastfeeding journey. Her passion for breastfeeding made her start a company called 360 Lactation, which helps to promote awareness on the importance of breastfeeding. Wow, you're welcome to the show. This is such a good
Thank
profile
you.
that you have here. Thank you so much for helping mothers with breastfeeding, and especially many, many thanks for also coming to teach us on ATP today. You're welcome, ma'am.
Thank you. Thank you
Yeah.
very much. I hope you can hear me.
Yes, we can hear you. I can
Okay.
hear you
Sorry
very
we
well.
are starting behind time, but thank God we are here now. Okay.
Yeah.
First of all, disclaimer. I'm not yet a lactation consultant. It's such a big title. I
Okay.
feel like, please, just say something about that. But thank God I'm a certified breastfeeding specialist, which is one of the steps you take towards becoming a lactation consultant. Okay, so let me just say that. Okay, so
All
today
right. Thank you.
we'll be demonstrating breastfeeding and lactation difficulties. When I was thinking of lactation difficulties, please, I can speak fast. When I get excited, I speak fast. So let me know if I'm speaking too fast. Okay. So when I was thinking of lactation difficulties, a lot of things came to my mind. I know mothers experience so many challenges when the first 24 to 72 hours of giving birth and trying to initiate lactation. But when I think about lactation difficulties, very few things come to my mind. So I'll just mention a couple of them and mention that when those two things when they do not go well the way they are supposed to, it can result to the other challenges that I'm going to be talking about later. Okay. So first of all, there's a common saying that says, if you fail to plan, you plan to fail. And I want to emphatically say that when it comes to breastfeeding, mothers prepare for so many things, but they fail to prepare for the actual act of breastfeeding. They buy breast pump, they buy nursing bra, they buy nursing pad, but you don't even know how to carry a baby, let alone breastfeed, know how to position the breast. So that's one major thing I feel it's lacking when it comes to breastfeeding. They do not plan. They do not plan. You meet a mother and you say, do you have a breastfeeding plan? No, they do not even know whether they are going to be exclusive or they are going to be doing mixed feeding. So when you meet a mother like that, it's quite confusing. Okay, so I want to emphatically say too that mothers should avail themselves of a lot of opportunities that are available to learn breastfeeding. Okay, so having said that, soon after delivery, when I talk, I'm going to be pointing accusing finger at so many people, and this is my story. It's not, I try not to make it like a fight. But I'm just, it's how passionate I am about the breastfeeding, and I see so many things that go wrong, both from when the baby is delivered, whether vaginal delivery or cesarean section delivery, from the part of the doctors involved, from the part of the nurses involved, from the part of the mothers involved. Everybody, we are saying breastfeeding is a shared responsibility. all of us that have shared responsibility, yes, maybe we pay lip service. We are doing it, but we are not doing enough. And some people, it just ends at lip service. Okay? So a woman comes to deliver. She has been mentioning that she wants to do exclusive when she delivers. And then from the moment she delivered, it was interesting. I heard one of the doctors speak when she said that baby was taken away from her. I just smiled because that's a typical situation of what happens. So the woman delivers, whether vagina or cesarean section delivery, and in the process of cleaning your baby is taken away from you. You continue cleaning, will clothe baby completely. Mother may not have even seen the baby, and the baby is taken away, perhaps maybe to check sugar level and the rest of that. She has not carried that baby. She has not. So the problem of breastfeeding begins from that time, where we take baby away to start dressing baby. I mean, like, yes, it's important, but those are not the most important thing. For a mother who has been saying, I want to do exclusive, she's depending on us to support her to do the exclusive. And here we are carrying baby and clothing baby and covering baby and doing all of that. So from the very beginning, it should start with skin to skin. Skin to skin. All you need to clothe the baby is a diaper and the cap on the baby's head. The rest of the baby should be bare. You don't need to start cleaning yet. Put that baby on top of you can even do the cleaning. In some instances, they will say do the resuscitation. Of course, if you notice that the child does not need active resuscitation, baby is already crying, all you need to do is suction a little bit. You can do that on top of the mother, but that in most cases, it may not be done. Okay, so skin to skin, that's where our problem starts from. Skin to skin on the mother. And there's what is known as biological nurturing. If you leave that baby there on skin to skin, the baby will crawl to the breast. There's no time after showing you a video that I made myself of a delivery that I monitored. And because she was saying she wants to do exclusive, of course, I was given opportunity, thank God. This baby was crawling towards the mother's breast. I remember the first dimension crawl, and somebody giggled and like crawl to where. But that's what we've taught. And I've seen, apart from seeing videos, I have seen it myself, where the baby was crawling towards the mother's breast. Of course, hospitals and their protocol now will not give an extra time for the baby, like we need to carry, we need to go and check and all. But then I was excited, the mother was excited. I said, you will not understand how excited I am, because I have seen this in videos, I have been taught, and here is it happening before me. Baby crawling towards the breast, looking for the breast to suckle. So one of the problems we have is that we do not give enough time for that to happen. Okay. And then apart from that, the positioning. For instance, I'll be mentioning a lot about first-time moms because I come across them a lot. You're a first-time mom, and you've really not had the opportunity to nurse a baby before due to no fault of yours. So, and then maybe your baby is just small, and maybe you're used to carry bigger babies, and here you are with a newborn baby, and you feel like this baby is too small, this baby is fragile. Can I hold this baby? You are still struggling with carrying the baby, let alone breastfeeding the baby. Okay, so that's another difficulties that mothers encounter: positioning in breastfeeding. And usually I hear a lot. I know that the most popular is upright. You sit upright and in a cradle position. I want to say here that the only position in breastfeeding is not sitting up upright. So there are 5 positions. There are more than that, but maybe I'll be talking about the 5 positions in breastfeeding. And 2 of them require that. Okay, maybe more than 2. But just note generally that it's not only sitting up. You can feed your baby lying down. You can feed your baby lying down sideways, even lying upright. When the biological nurturing I was talking about, it's a frontal position. The baby is laid in front of you like this, and baby is sucking. Okay, of course, and I'm particularly mentioning that time because if you're a CS mom, you will not get up immediately you deliver. So there again, you also need support. Of course, a woman who just came out of the theater, she may be in pain, a whole lot of things will go wrong. So that's not to take away from the fact that normally cesarean section has a way of interfering with breastfeeding. So it's not going to take the normal pattern it should have taken. But that notwithstanding, it should not stop a mom from breastfeeding within the first hour of delivery. Okay, so I'll be demonstrating the different types of position, the ones that will allow me while I'm seated here. And because we had an initial problem, I don't before now, you could see the bottom, but let me just try my best so I don't take a lot of time. So the first position I'll be demonstrating is cradle position. Now, in cradle position, you have to sit in a chair, preferably a chair that has a backrest, and preferably your feet. If your feet come like this chair I'm sitting on, my feet is touching the ground. Say for instance, your feet is not touching the ground, you need something that will elevate the feet of your feet a little bit. Okay, in my hospital, I will bring the baby cot across. I'll tell the mother, so you rest your leg here. So she's comfortable. You need to be very comfortable when you breastfeed. Very, very comfortable when you breastfeed. So this is a cradle position. My back is well rested. My arms are rested. If possible, if you're at home, you can prop up pillows or duvets to support your arm, to support your back, and sit comfortably. Rest your leg too. Okay, so let me demonstrate a cradle position. This is baby. Now look at me, or mothers who have first time moms. This is baby's arms. This is baby's arm goes under your armpit here. Like, hope you are seeing what I'm doing. I'm trying as much as I can to put the camera under. Sometimes you are afraid. I mean, for a first time mom who does not have a clue what to do, baby's hand is here. Am I going to compress my baby's hand here? You put your baby's hand under. Baby's hand goes across. Okay, and then first thing, stomach to stomach. Turn your baby facing you like this. You don't want a baby that will be facing up and then baby's head is turned towards you. So it's only baby's head that is turned towards you. Baby's body is facing up. You want your baby turned towards you like this. Okay? So you see what I'm doing? This, say for instance, I'm holding the breast. This is a cradle position. Cross cradle position, sorry. This is a cradle position. Cradle position. And then for cross cradle position, remember you still have to be well seated. It's so important because you see a lot of mothers who struggle to breastfeed and they're like this. There is no way you can breastfeed for 5 minutes or 10 minutes in this kind of position, and you may adopt that position unconsciously. You are just keen on putting baby to breast. You not realize that you are not leaning towards your baby, you are going towards your baby. So you need to understand all of that. So this is me describing cross cradle. Remember I mentioned cradle position. Now I'm talking about cross cradle. So cross cradle, you use your other hand, go across like this. Are you seeing my arm? Initially it was this hand that went like this before. Now this hand is coming like this. I may decide to hold my breast, I may decide not to hold my breast, but this is a cross cradle position. I hope you're following what I'm saying. Cradle position, stomach to stomach, baby facing me. Look, my arm on baby's bum, baby's head across my elbow like this, to face like that. Then cross cradle like this. Okay. There is a particular position that I super love, especially for CS mom. But depending on individual, they may not like it. Is what we call, it is called rugby, it is called clutch, or it is called football hold. These three names are referring to the same type of positioning. And how do you hold? You put the baby across. Let's say there's a duvet or a pillow across. And this is where I promote breastfeeding pillows. If it's only at this time, yes, I'm in support of breastfeeding pillows. I know there are a lot of people who are against it. They feel it's just a waste of money. There are other substitutes notwithstanding. So you put your baby across like this. Of course, don't tuck your baby leg baby needs to be free too. Position, the video is not there. I'm going to stand if need be. So this is me describing baby across like this. Underarm, baby is here. All I need to do is to hold baby's head. That is all. Please let me know if you're not seeing well, because I'm struggling to be in a position that the video can show what I'm doing. So baby is across like this.
We can see you. Just go ahead.
Okay. So there's a breastfeeding pillow, the C or the U-shaped one, and baby is at the end, at one end of the pillow, or a pillow, a duvet. Use it to support yourself. Then you place baby there. So you hold baby's head. Now this position frees your surgery site. So you're not putting pressure on your surgery site for a woman who just did the surgery. So it frees your hands to also hold your breasts. Okay. Yes, thank you. We are seeing me. Okay, that's good. Thank you for letting me know. Okay. So you hold your breast and then hold baby's head. Like I said, I super like this position. I'll let you know later why I like this position. Because a lot of mothers are concerned about, oh, I don't want my breast to cover my baby's nose. I don't want my breast to cover my baby's nose. That should be the least of your problem. Because if you position baby well, no matter how big your breast is, and I'm saying this from, I've seen hundreds of breasts. I'm not bragging now, so, but it will not cover if you hold your baby, if you hold if you position well, it will not cover the breast. So don't be concerned about trying to press your breast back. Instead, give the breast to the baby. Okay, so that is for clutch. I said it's clutch, or it's football hold, or rugby position. And there is double clutch for mothers who have twins. The only challenge there is when you position one yourself, you need another person to help you position. But say you are desperate, baby is crying, babies are not that heavy. There's a way you will maneuver the two of them, and you are seated comfortably. The two babies are there sucking, so you don't need to wait and finish breastfeeding one and then wait to breastfeed the other. No, two of them can be breastfed at the same time if you use this position. Of course, I've seen mothers who do this, so, but you can do this if the babies are small. If they are big, it may be challenging. So this is one method where it is super free. Like and if the babies are comfortable, you can even leave the head, and once they've learned how to latch well, leave the head, and let them suck. And then you focus on massaging. As they suck, you focus. So your hand is also free to massage the breast, because I'm going to talk about while you're either you're pumping or you're breastfeeding directly, you should massage the breast alongside. That's why you need your hands to be free. So any method that helps your hand to be free, not too occupied, focus on trying to remove your breast so it does not cover the baby's nose. Any method that helps you to do that, welcome it, because you need to massage your breast alongside your baby sucking. It helps to bring out more milk. So I've talked about three methods. I've talked about cradle, cross cradle. I've mentioned football hold, and you mentioned double rugby, double football hold, and then the frontal. The frontal one, I'm going to emphasize that if mother is tired, let's just say you just delivered. Of course, you're lying face up now, or even CS delivery. You're lying face up, so the baby is facing you like this. Once you learn how to position, of course, sometimes initial time with support, you can breastfeed your baby like this. Okay, let's just even say you decide to support your baby with the head. Allow baby's body rest on you. You support baby's head and you hold your breast. So this is lying down now, frontal lying down position. And then there's also the side lying down position where you lie by your side and your baby is also lying by your side too and breastfeeding. So I think I've mentioned 5 or 6. Please let me know. Let me know if I didn't demonstrate it well. If I do not take away, if I not teach you anything today, one thing I want to let you know is how to position, because that's where it starts from. How to position your baby. If you're not positioning your baby well, how will your baby get enough of the breast? How will baby suck? So that's where the problem starts from. So whether you're having cracked nipple or sore nipple or inefficient emptying of the breast, it starts from positioning. I'm going to talk later about how you hold your breast. You heard me talk about people concerned about not covering baby's nose. It is a legitimate concern, but you do not need to if you learn how to hold your breast properly. Okay, so I'm going to dive back to skin to skin again. So first of all, like I said, skin to skin, soon after baby is delivered, let baby be with you there. Everything can be done. And then another thing I want to say, you have to speak up. If you're a mom who has planned to do exclusive breastfeeding and you deliver in a hospital where they are busy doing their work and nobody seems to be caring about whether I want to breastfeed or not, speak up. It is your right. They will not ignore you. I know I will not ignore, and I know nurses that will not ignore you. If you say, can you please help me? I want to put my baby to breast. Can you please support me? You just be polite. Even if you are rude, we will still help you. But just be polite and speak up. Don't think, oh, they know better. They will bring my baby for me to breastfeed. Oh, they know better. Speak up. Be assertive. I want to breastfeed. Can I have my baby? That will lead me later to another thing. Because I said I was going to point an accusing finger on everybody, including the mothers. Okay, so I'm going back again to skin to skin. So skin to skin does not just end at that time you just delivered. Even when you've been taken to your room, you are more stable now. Every opportunity you get, sleep with your baby there on your chest. Of course, I know you are exhausted. Please don't get me wrong. Don't think I'm not sensitive to the fact that you have just delivered. You need to rest. In fact, nobody thinks the need to rest more than I do, because I know that breastfeeding is a marathon. It is a marathon. No, if there's anybody here that have not breastfed that is listening to me, it is not child's play. It is doable. It is good. It is prescribed. I mean, I don't need to be saying about the advantages, but it is work. But the good thing about the work is that it is more at that initial time. It gets easier over time. So come in prepared. I don't know if I mentioned, I didn't mention. Okay, I did. I said fail to plan. Preparation. And part of the preparation that I used to emphasize on is preparation of your mind. So that when you come in and you meet somebody who is not in support of breastfeeding, and the person tries to sway you, say, I beg you, go rest first. Later, you can give formula. You are assertive enough to say, you are convinced enough to know what you want, to let the person know that no, now I go start. Sorry, I'll be bringing in PD for that side. You just come in naturally. Okay, so be assertive, know what you want. If you come in undecided, you're not sure, should I not, anything that happen goes. But if you know what you want, you are convinced that it's going to be difficult, but I will do it. Other people have done it, I will do it. So you need to keep telling yourself. It's important, because I've seen mothers who come in, what do you want to do exclusive? Midway through, I laugh to myself, like, see the person that says she wants to do exclusive. Okay, it may seem funny, but you need to be prepared. You need to be prepared. I cannot emphasize it enough. You need to be prepared to breastfeed, because your life will, like, you will not, especially if you've not had babies before, you will not recognize whether it's you or not. You have not slept with the pregnancy you've been dealing with since, and yeah, baby confused, like your problem with double. But let me not discourage you. But that's the reality, okay? But it's a beautiful, beautiful reality. In that this baby that you're looking forward, here is your baby before you, okay? So know what you want, be convinced about what you want, so that when you hear other things that is not aligning with what you want, you're able to speak up. Okay, so I'm going to go back now to position. I've talked about positioning of baby. I'm going to go back to positioning the breasts. It's so
Okay.
important. Don't tell me my breast is missing.
We must find that breast.
Where is this breast? Okay, I've seen it. Okay, so this is the breast. Hmm? So I'm going to take it away, even though my stand here is a diagram of the breast. I'm going to show you this. Later on, I'm going to talk about some parts that I want you to note. Yes. You see this part that is here? Am I sure? Is it clear? Let me know if it's clear. I want you to take note, because this is an important part. This is the nipple, this is the areola here, and this is the ampulla, which is also known as the lactiferous sinus. It's in form of a sac. We'll talk about that later, but just note that's like a short anatomy of what your breast look like. So this is the breast, this is the nipple, this is the areola. My areola is very small. There are a lot of mothers with very big areola. So when you say, well, I've heard people demonstrate that you ensure the areola enter. Does not mean if I have big areola, all my areola will enter baby's mouth. So no, that is why I was showing you that. Okay, so that you understand. This areola, for instance, see this my small areola, it can enter baby's mouth completely, but not everybody's areola can enter. I've seen areola that is as like half of the breast. So if you have that, don't worry about will it enter, will it not enter. Okay, you don't need to worry that you enter baby's mouth completely. So this is the breast. First of all, I assume that as part of your plan to breastfeed, you have been preparing the breast. The moment you got pregnant, your breast knew that I'm going to breastfeed though. I'm going to breastfeed though. So it starts preparing. Milk started collecting in the breast while you were 16 weeks pregnant. 16 weeks pregnant. That's to tell you that you are not the only one preparing to breastfeed. Your body is also preparing. The breast is also preparing to breastfeed. So it will enlarge in size. At times you feel that it is heavy, it is full. In some cases, it may also be painful. All of those are preparation to breastfeed. And as a sign to let you know that your breast is actually preparing, usually you will increase in, let's say, an inch cup size. So if you're using a certain size before, normally you should change your breast size. I remember asking a mom once, her breast was so small. I was worried that did this breast grow while she was pregnant? Because if the breast did not grow, it's a problem. And she said no. And like, this breast did not grow. The husband said yes, it grew. Remember that you complained that your bra was too tight at some point. So maybe the husband said that just answered my question, that the breast actually grew. It's just that she didn't take note. So your breast should grow in size in preparation to breastfeed. Okay. And then a lot of mothers come in with a scaly thing around the areola. Once I see a breast, I know that it didn't prepare well. I ask, did you attend antenatal? No. There are a lot of hospitals are doing antenatal online. So you don't have to go in person to do it. I say that is a sign. If you had attended, you would have known that this thing, normal bathing will not take them off. You bathe from today till tomorrow, it will not go off. You need oil base, like okay, nipple butter, even coconut. Let me not go into all that. Coconut oil, olive oil, even Vaseline will take it off. A generous amount should be applied. If you have a breast that the nipple is scaly, this is for pregnant mothers now. So when you come in, you're not putting, you put baby's your breast baby's mouth, and you see black tissues, debris all over baby's mouth. You're using a breast pump. The same, it will take some days for it to wear out. Those are the preparation you should have made before delivery. So a generous amount of the oil applied on it, you can put your nursing pad on it and leave it. It will break them down. That's when you now use your sponge, it will come off. It will even take 2 to 3 times before it will come off completely, if it is much. But you need generous amount. It's not because you have not been scrubbing well, you have been scrubbing, but normal soap and water will not take it off. Okay, just take note of that too. And the same thing goes for when you are preparing the breast. You try to check. If I meet a breastfeeding mother, if I meet a mom who is pregnant, one of the first things I ask her to check, do you have inverted nipple in the breast examination? Apart from checking if your breast has grown inside, do you have inverted nipple or flat nipple? There are different types of inverted nipple. Some with stimulation, it will come out and remain out. Some, it will take a little bit of effort. So you may need a nipple puller or your hand to pull it out a little bit. And once it comes out, it will stay out. And then there are some that nothing makes it stay out too. Even if you need to use a nipple puller and it stays out, once you remove the nipple puller, it goes back into the breast again. So there are different types. So understand the type that you have and prepare to pull it out. You can gently, with a lubricated hand, as you wash, as you clean, try and pull it out from time to time. It's all part of the preparation you need to. If you want to get a nipple puller, get a nipple puller to also pull it out. So back to breastfeeding. So after you have monitored, clean, and done all of that, one of the things you have to note, you have to massage the breast before you start breastfeeding. Massage the breast. How do you massage? This is my breast. Look at my hand. In a circular fashion. Okay? You go around. You can do that. You can also create a fist and massage too in a circular fashion. But you can even decide to do this too. They are all different forms of massage. If you have enough time, this is after you have left the living room or theater or recovery room or later on. So if you have enough time, you can use a warm compress, but one that your body can tolerate. Wet a towel with a warm water and massage it. Instead of using just your hand, use that warm towel to massage your breast. And then after positioning baby correctly, the next is to position your breast. So how do you position your breast? You sandwich the breast. Take note of the terms I'm using. Sandwich the breast. Now, in midwifery, I think we're taught scissors method and the rest, where mothers put their hand across. Can you see my hand? when mothers put their hand across like a scissors. I discourage that method. I understand that perhaps what works for you, you should stay with it. But the initial time, if you meet me, I will discourage you from using that method because you are in my way. You are in the way of baby's mouth. That hand is in the way of baby's mouth. You don't need to do that. You are looking for baby to take the breast. You're not trying to take the breast away from baby. So instead, hold like this. That's why I said sandwich. When you're eating a burger and the burger is big, what do? You compress the burger and you open your mouth wide. It's the same thing you do with the breast. You sandwich. Look at my hand again. My thumb is up. The other part of my fingers are underneath. And I'm giving enough space to the areola. Even if my areola is big, I'm giving enough space. At the same time, I am sandwiching the breast. If you notice, I'm pulling the breast forward for baby to take. I am not dragging it back. I'm giving, like, take. I have access to it. Like, this is what I'm doing. If I use both of my hands, this is what I'm doing. You sandwich the breast. Okay, that's what you do. And then secondly, you wait for baby. That is why you need to monitor your baby's feeding cues. Baby would have been giving you signs left and right. I want to suck. Cry is the last stage of the hunger sign. It's when you do not respond to all the signs they've been giving you, they start crying. For a mother who is learning and a baby who is learning, once they start crying, they are cooperative, they are forcing. You are confused, baby is confused, the two of you will start crying. Okay? It is all of those that will not later lead to depression that mothers complain about. Preparing psychosis is real, prepared depression is real. If you learn and do what you're supposed to do, you will prevent all of those. You will prevent all of those. So you take step first. Don't wait until you have your baby before you start learning. When your baby comes, it becomes an emergency. You cannot stand to see your baby cry. So anything, you hear somebody mention formula, so yeah, bring it now, bring it now. Because you cannot stand to see the baby cry. This is you that have been preparing to breastfeed exclusively since. Baby is crying and you don't know what to do. Anything anybody suggests, so yeah, let's do. Later we cannot do exclusive. I'm speaking reality. Okay. So learn now. Take the step to learn now so that you will prevent all of those. You will not be in that stage where you say anything goes. You'll be composed, you'll be in a position that, oh, you're on top of situation. You know what to do. So you sandwich and you carry baby when baby is not crying yet. And you wait for baby to open the mouth like a yawn. Initially, I said sandwich. Now I'm saying like a yawn. When you yawn, you don't open your mouth like this to yawn now. You open your mouth wide. That is how you should wait for baby to open their mouth wide. And how do you tease baby with the nipple? You tease. You see what I'm doing? If you notice what I'm doing, this my nipple is pointed up. Okay, and positioned in baby's mouth in such a way that when baby takes it, more of the bottom will enter baby's mouth than the top. Your position like you are using this nipple to touch the upper part of baby's lips. It's touching the upper part of baby's lips. So when baby opens the mouth like a yarn to enter, more of the bottom enters than the top. That's the position you want to adopt. So you first of all, you sandwich and you patiently wait for baby. So babies will take it with a small mouth. Be patient. If it's something that you can remove. If you cannot remove it, leave it. Don't be in a hurry. Eventually, there'll be opportunity for you to reintroduce it again. But be patient and wait. Mothers are not patient enough to wait. Like a young, when you are patient, you see the baby open mouth. When you open and say, see, that is the position we are looking for. Oh, yeah, put it. When you put it, you are not shoving it into baby's mouth. Too. You gently put it and baby takes it. Even for a baby that is learning how to lash, it will enter baby's mouth enough. And then whether baby can suckle from there, that's another ball game. But you have introduced it well and you continue to do that. Okay, it is super important. Now that will take me to the concerns that mother have about the breast covering the nose. I am doing a cradle position. I've carried my baby like this, cradle position. I'm holding my breast. Okay. Now, if possible, what I used to, that's where I support on anything that supports you. I was okay, support with a pillow, support with a breastfeeding, anything you can. Baby is still facing me. I gradually remove this my hand and I hold only baby's head. Baby is still facing me like this. We are still breastfeeding now. Only baby's head. And I see what I'm doing. This is called like balloting. The rest of my thumb, not my index finger, the finger, my middle finger, my thumb and my index finger is what is holding baby. Look at me carefully, oh. Cradle position. Gradually remove my hand from that cradle position and I come to baby's head. See the way my hand is, it's supporting baby's head. My hand is on the shoulder, it's on the neck, it's on the head. It's not for me to hold like this, and baby's head dangling on. So it's going to support all of that on the shoulder, on the neck, on the head. My hand goes like this. So while baby is sucking like this, I gently tilt baby's head backwards. My breast is massive, remember, but I tilt baby's head. When I tilt baby's head, the chin pushes towards your breast. So between your breast and my chin, there is no space. My finger cannot enter. So the chin is sticking to mother's breast completely. And when that happens, it frees the nose. I may not even be holding my breast at this time. It is just me and baby's head. I tilt baby's chin towards my breast. The head raises up a little bit and it frees my breast. So you don't need to focus on, I've heard mothers say, oh yeah, oh, don't let it cover. Yes, it's not covering. It's not covering, it's not covering. The breast that is supposed to enter baby's mouth is what we are taking away from baby's mouth in the name of you do not want your breast to cover baby. So I don't know if you understand what I'm saying. It is super important that you understand that. There are positions you can adopt. Your baby's nose will not, your breast will not cover baby's nose. Okay? So that is that about holding the breast. Now, there's something I want to talk about. The thing about sufficient breast milk. I've mentioned lashing. I've mentioned positioning. Now, the other things I'm going to be talking about, I mentioned skin to skin. The other things I'm going to be talking about is it will be centered around if you do not do all of this, some of the other things will happen. For instance, engorgement. Remember that I said from 16 weeks, your breast started producing milk. So by the time your breast is full, it's not full because it wants to be full, because there's something there. Okay, the skin to skin that you do will stimulate oxytocin to be released. And what does oxytocin do? It encourages the milk ejection reflex. The milk that is already in your breast, it enables that milk to come out. That's the function of the oxytocin. And remember that when your baby is with you, a lot of that oxytocin is released. The sound of your baby's cry, the sight of your baby, the touch of your baby, all of those help your body to release oxytocin. So it is important that mother and baby remain in the same room. I cannot emphasize that enough. Remain in the same room. I'm emphasizing it because I meet a mother who says she wants to breastfeed exclusively, and I will lecture up and down. The next 2 hours, we are still talking about the exclusive, and I emphasize that it is important that your baby be with you. Stay with your baby. If the nurses take the baby for any reason and they are not bringing baby back, please ask for your baby. Meaning that you will wake up even at night to feed the baby. And the same mother, by 9 p.m., mother will buzz, peel. You come and say, yes, what is it? Say, please take the baby away. Take the baby away to stay with you for the night. There are mothers who do that. So you cannot have your cake and eat it. I mean, you cannot eat your cake and have it. If you want to practice exclusive breastfeeding, you have to stay with your baby. Your baby has no business in the nursing station or in the nursery. Your baby has no business in the nursery. If you are well, your baby is well. Baby should be with you. Of course, if you are tired, you speak up. And that's where I encourage you not to get too excited receiving phone calls or receiving visitors, because you've gone through a lot. You need to rest. Reserve the little energy you have for you and your baby until you recover fully. So that's another thing that may discourage it, that may help your breast not to come in when it should come in, because of separation of mother and baby. The mother and baby diet should be together. What we learn then in school is to say encourage rooming in, mother and baby together. But there are mothers, that's why I'm pointing fingers at mothers. There are mothers that will call you to come and carry their baby away for the night. There are husbands that will beg you to say, please, oh, at night, come and take this baby away. I want my wife to rest. So you cannot want your wife to rest. You cannot rest. It's not as if you want baby to be crying in your ear all the time. No. And that would lead me to cry. Why? It's not all of the cry that is due to hunger. A wet diaper will make a baby cry. Even just thought, just carrying. So the lot is known as non-nutritive suck. Baby is not crying. You're not breastfeeding because baby is hungry. Breastfeeding is yes, I am hungry, oh baby will cry. I am wet, oh baby will cry. I need to be touched, oh baby will cry. I need to be carried, oh baby will cry. Cry is baby's language for different things. So when you put baby to breast, it is not because you want baby to just suck. It's not because you want baby to feed. It is non-nutritive. It is meeting that baby's needs, whereas it is not due to hunger. And then, of course, for the bird that we are waiting to bring out more milk, that sucking will also bring out more milk, but it's not due to hunger, by the way. Okay? And that will not happen unless your baby is with you. So please, mothers, stop. If you continue bringing your baby to the nurses or asking nurses to carry, we will carry your baby for you. But do not say nurses are not supportive when it comes to the breastfeeding thing. Yes, nurses have their fault, the role that they play. I said lip service. Yes, I know breastfeeding is important, but I give it half service. So mothers too also have their fault. If I do not carry a baby, you think that nurse does not care. The nurse does not. So a whole lot of things go on there that I don't want to go into. But just take note that if you want to breastfeed, your baby needs to be with you. Your baby has no business. Has no business with the nurses. If the nurses carry your baby, after a while, ask for your baby. I feel so excited when I see a mother say, please, I've come to ask for my baby. Yes, that's the correct thing to do. That's the correct thing. Your baby should be with you always. If your baby is with you always, you will know that every minute the two of you are in the breast. To every minute you're sucking. Tell me how breast milk will not come out. Okay? So that will now lead me to and expression. And the expression is a method, of course, I learned it. But for my practicing with mothers, I find it super, super effective. If you and express correctly, within 24 hours, you'll be feeding your baby five meals of breast milk. Now, why would you even be under-expressing? You will say, can you not put baby to breast directly? There are times that baby will sleep. Babies will fall asleep. So you will not wake baby because you want baby to be at the breast now. And then you are alert. You have rested a while, baby is sleeping, you are alert. Rather than just be there pressing your phone. Remember that we are looking for breast milk. Oh. You don't have all the time. When baby wakes up now, baby is going to start crying. Instead of using that time to press your phone and just be occupied, gisting away, start hand expressing. How do you hand express? Is another method I want you to learn. If you learn it, it will save you and your baby the whole wahala of excess cry or going to resort to formula because breast milk is not coming. So this is your breast. Your thumb and your index finger, they are positioned on the breast like this. Remember I said my areola is a small areola, so it can afford to stay just by the areola here. If you have a bigger areola, just give an inch away from your nipple. Put it there, an inch away from the nipple. My thumb and index finger. So you put it like this. So first of all, you press. When you press, it's like you're pushing your breast back into your chest. You press, you compress. When you compress, you are compressing on the areola. This part that I showed you before, the ambula or the lactiferous sinus, that's like a sac that contains the milk. That's the part that you want your baby's mouth to be on when baby lashes. It is the same part you are compressing. It is not in the nipple. Put your hand an inch away again. You press, you compress and release. Press, compress and release. Remember that the mother have just delivered at this time. So there are lots of hormones in your body. So the breast is super sensitive. So you may be feeling some sensation, not necessarily pain. For some, it might be pain. For some, it might be sensation. If it is not pain, enjoy it. If it is pain, perhaps you may need to stop. If it is not pain, enjoy it. I'm saying this for a reason, because if you are in pain and you are trying, the pain will inhibit breast milk from coming out. It's like stress. Stress and breast milk cannot stay together in the same room. One must give room for the other. And in most instances, it is the breast milk that will give room for stress to stay. Okay? So it is the same thing. If it is not paining you, continue. And as you do that, for me, what I tell mothers is, I'm looking for just one drop of breast milk. One drop of breast milk. If one drop comes, 2 drops. If I continue, 2 drops. If I continue, 3 drops. If I continue, 4 drops. But before you know it, a small baby spoon is filled up. Remember, baby is sleeping. So what do I do with that spoon? If you ask nurses for a syringe, they will give it to you. Use a syringe to withdraw it. And if baby is awake, baby is not crying, you can put it in baby's mouth. Baby will lick it out of the spoon. If baby is asleep, withdraw it with a syringe and keep in the fridge. Continue doing that. If every 30 minutes you can express that baby spoon full, in no time, I'm talking about 24 hours of delivery. 24 hours of delivery, you are already expressing breast milk. So where does the problem now come? Why is it that mothers now say, 3 days now, breast milk is not coming out, so we have to give formula? It is because you want to do exclusive, but you do not want to do the work of exclusive. That's me pointing fingers at mothers. It is the same way nurses know that they should support mothers, but they use lip service to support. They do not do the work of supporting mothers. Or they do hospital intervention and protocol that interferes with the actual breastfeeding that is supposed to be. So you cannot just use your mouth to do lip service. I want to breastfeed, yet you want to sleep extra. Of course, you will sleep. Don't say I'm not being sensitive. You will sleep. The baby is here now, and it's a marathon. Marathon means that every hour you're on the breast. Every hour. That's why we call it feeding on demand. Every hour you're on the breast. Every hour you're on the breast. So the few times that baby will give you space, you will know that this few hours is precious. So let me use it to sleep. Because baby is going to make sound again. I will feed. That's the marathon at that time. It gets easier. Once your milk comes, it gets easier. And you will be happy you did. You will be super, super happy that you were able to breastfeed. Okay, so I'm not I'm going to leave the rest for question and answer session. I have things like engorgement, mastitis, inefficient milk supply, a whole lot of other difficulties that can occur. But I know mothers will ask questions in that direction. So when they ask questions, let it be that me answering and touching those areas. So basically, this is a summary. I cannot exhaust everything, but it's a summary. And I hope you have learned 1 or 2 things about it. It is super. I cannot emphasize it enough. Oh. See this an expression that I taught you. Go and learn it. Go and watch videos. The videos everywhere. Press, compress, release. Press, compress, release. Press, compress, release. Before you know, a drop is coming out. The initial drop that will come out clear. It will not be colored like colostrum that you know. It will be like water. It is all part of it. Collect it in the spoon. Continue. Before you know, a small baby spoon is full. If you keep doing that, within 24 hours of delivery, you will not be looking for breast milk. But mothers are not ready to do it. That's the truth. Oh, this is me, a bedside nurse, supporting mother. I'm the one who's even pursuing. Oh yeah, let's look for milk. Oh yeah, let's look for milk. Oh. Not all mothers. I'm sorry, let me not generalize. So, in fact, when you meet a mother who is ready to do it, you will know. In fact, you'll be happy. For me, I will be excited to meet a mother who is ready to. And I find out that my work is less because before I go to remind her, yeah, let's put baby to bed. She's already putting baby to bed. Oh, let's do this. So when you meet a mother like that, you know that she's really exhausted. You cannot wait to say, oh yeah, rest. Oh yeah, I'm going to take baby now, bathe, sleep for a while. You support, give the extra support, but So it's not like almost like maybe it's the kind of mothers that I meet, sha. So maybe I'll hear your story. Was it like that for you? Were you the one that would say, "Come and carry my baby," and yet you want to breastfeed? Are you that type of mother that will be taught, "Oh, yeah, let's do an expression you will know what to do," and yet you want? So you need to know what you want and do it, not just to talk. Be ready to do the work. So that's it. That's like a summary, if you call if you call it that, about the demonstrations of breastfeeding and then breastfeeding difficulty, lactation difficulties.
Thank you so so much. This has been such an exciting session. I mean, sometimes people can forget what they hear, but it's mostly difficult to forget things that you are able to visualize. I love that your baby. I love that breast. I think they should make it compulsory for mothers to have it during those clinical visits before you have your baby. So we've been seeing some appreciative comments and also some questions. Okay, yeah. So I have one here on the screen from Salami Shiku Dolapo, and she's saying, "How do I dry up the milk after weaning?"
Okay, to my knowledge, you just stop expressing. That's how the milk works. The more it works for demand and supply. If you want more breast milk, you keep creating demand. And if you do not want any more, you stop. Initially, it will be so uncomfortable because the milk that is used to coming out before we gather, the breast will be full, it might be painful. So you might need to take a pain med 1 or 2 days, and gradually it will stop. And that will take me to mothers who travel. Okay, I've encountered mothers who say, I traveled, by the time I came back, there was no breast milk. You need to protect your breast milk if you have not stopped breastfeeding. If you stop breastfeeding for any reason temporarily and you do not keep expressing, your milk will dry up. So protect your breast milk when you travel, wherever you go to. Protect, even if you have to express and dump. In fact, my head is big when I say express and dump, but sometimes it's a reality that you have to express and dump. It's just to let the body know that, please, I want you to keep producing, keep producing.
Yeah, I'm still
Because if
feeding.
you do not let the body to keep producing, by the time you need the breast milk, it will not be there. And that brings me to, I encountered a mother who had a bad case of reflux, really, really bad. So she was told to use formula, and in that period she was using formula, she stopped expressing. By the time she discovered she could not bear the cost of the formula, please, let's just go back to breast milk, because this was not caused by breast milk nor formula. Anyone, baby will still have this reflux. There was no breast milk for mother to go back to. There was no breast milk. So it was breast milk we started chasing. So protect your breast milk if you are not done breastfeeding. Pump and dump if you have to. But if you do not have to, pump and store. If you have a fridge, pump and store. So if you want to win and you don't need it again, just stop pumping. Just stop. It will eventually dry up.
Breast milk is really gold. That's what you're saying. It is gold. Yeah. All right. So Obiageli Ezia Basil is saying, please, how do you treat dry or cracked nipples?
Okay, so cracked nipple, first of all, what is the cause? That's where we're talking about lashing. If you lash correctly, you should not have sore nipple. But of course, there's this for constant friction and the rest. Your breast may feel sore and a little bit painful, not necessarily pain, not cracked, not open wound. In that case, you are encouraged to apply a nipple butter, any of those balm that they apply. Ensure that the one you're applying is edible. But if the cause is actually cracked nipple, you are not doing something right. That's why you're having cracked nipple. And the simplest thing that comes to mind is poor lashing. You're not lashing correctly. So you need to ensure that your baby is lashing well. You need to ensure, does the baby have tongue tie? Is the tongue tie bad enough? Because the tongue is supposed to be released to collect the breast and suckles on it. So if there's a tongue tie holding the breast from the tongue from coming out, baby is not latching well, it can also result to that. So first of all is to find out what is the cause. Why are you having cracked nipple? If is it poor latch that is causing it? If it is poor latch, they need to learn how to latch correctly. And if it is nipple tie, what's it called? Yeah, tongue tie, sorry.
Tongue tie.
It needs also, it needs also to be addressed. So that's what I would think. But if it is, if even if it is a poor latch that led to it, you just ensure that that place is dry, okay? Because if infection sets in, it can lead to mastitis. Mastitis not well and can lead to abscess. So you need to ensure that your breast is clean. Remember that that wet place, microorganisms thrive on your wet place, so and breast milk for that matter. So ensure that the breast is clean, it is dry, and then apply the balm. Another thing you can, while you are enduring the pain, another thing you can use is a nipple shield, so that the baby is not sucking that, because baby must suck whether you have sore nipple or not. So baby is not sucking directly on the wound and opening it more and more. You can use a nipple shield temporarily. When baby suckles, baby is suckling on the nipple shield until the wound heals. So that will take me back to what I wanted to say about massage as you breastfeed. See the way I'm holding my hand. Okay, let me use this. You massage. That's why any method you can adopt that frees your hand, the better. You have other babies, you need to attend to your other baby while you're breastfeeding one baby. So you need one hand to be free. Even if your baby lashes well, you need another hand to be free enough to massage as you breastfeed, especially the underhand where you have lumps and the rest. Massage those areas. The same thing when you're using your breast pump. Use your breast pump and massage. Breastfeed and massage. Don't just leave baby there for baby to be sucking. Assist baby. It's the same thing that goes for when you're breastfeeding, especially when you just start. Don't leave baby to struggle to get the breast. Bring baby to yourself. Bring the breast to baby. Help baby to make it easy by bringing baby and then you giving baby the breast. So it's both ways. Okay.
Thank you again. Yes. Queeneth Okonta is asking, can twins be
Yeah.
exclusively breastfed?
For sure, let me tell you a story. I met this one when I just started breastfeeding newly. So I met this woman who wanted, she so badly, she's an elderly private caregiver. She so badly wanted to breastfeed. So I started with that, we are going up and on. I mean, she was one of those that cried when her milk was not coming out enough. But we did the expression, and then anyway, by the time she left the hospital, she was already, milk was already coming out. So I met her and then we lost contact. I met her 3 months or 2 months after the immunization, the one of those days. Babies were big and all. So the pediatrician was asking her, so what are you giving to your baby? She said breast milk. I was waiting for her to laugh like it's not true or anything. He said, ask Nurse Rosemary now. She knows me. She knows my story. Only breast milk. There are mothers too. There's another. In fact, I have a lot of those stories in my DM. They will start by crying. When this I say, don't worry, I'm going to when you start giving baby enough breast milk now, I will show you this cry that you were crying initially that you did not need to cry. So if you're having challenges with your breast milk initially, don't get depressed. Don't. Maybe that's where this breastfeeding support comes in. Mothers need to hear from other mothers who have successfully breastfed that you can do it, or no need to for you to be sad. Of course, that was how I started breastfeeding. I entered the mother's room, she was crying. Why are you crying? That she's not getting no breast milk, she wants to breastfeed. I just realized that mothers needed extra support. That was how my breastfeeding thing started. Okay, so when you are breastfeeding your twin and you feel you're not getting enough, talk to somebody. That will now bring me back to look for where you can get help before you deliver. Know where help is before. It's not part of the plan. Know where help is, because when you deliver, it is a race against time. You don't want your baby to be here before you start looking for where can I get, if I don't know who to talk to. Is there any breastfeeding nurse around? Is there any doctor I can talk to? That is not the time you look for where help is. Look for help while you're pregnant, so that once you have any problem, in fact, you start talking to them before you even start breastfeeding. So once there's any problem, you meet them. Maybe just one or two things you are not doing right. But generally note that demand drives supply. So if you are breastfeeding enough, don't you know that people can breastfeed with only one breast? So imagine if you're a mother that has only one breast and you're feeding one baby. So why can you not feed two babies with two breasts? It is the demand that you make on the breast. Of course, it will tell on you. That's where you need your support system. Support system cannot be overemphasized. Your husband is your support system. Your mother-in-law is your support system. Your younger, offer every family member around you. The one that you can just send on errand to help me fetch that water, help me bring that cup of tea, help me arrange this chair well so I can sit down. They are all your support system. It is while you are pregnant, you start preparing your support system. Let them know, I want to do exclusive. Oh. All of us are in it together. Oh. I've had husbands help the wife to do this and the expression I'm talking about. No, anything, tell me anything I will do. So the husbands are willing and ready to support. The same thing for mothers. So let them know they are going to play a role. Don't take it for granted that they are going to support. Let them know, give them their job description. You are the one who breastfeed. You are to make you comfortable. Bring cup of tea while you breastfeed. Make pap for you while you breastfeed. Bring the chair while you breastfeed. Put the pillow on your back while you breastfeed. They are all support. And when let's say you're not able to sleep, when you pump, they cannot help you to feed while you sleep, that extra sleep, because you're having a headache or you are tired. So your support system, they are super, super important. So for somebody who knows this is expecting twin, prepare your support system. Even the people you have not been talking to before, start contacting all of them. So when they come, it's not just to gist and to laugh. Everybody will work so that you can breastfeed.
All right, thank you so much. So, when you were teaching, you said something about preparing the breast for breastfeeding. So, Khadijat Adenike Karim is asking, at what month should this be done?
From the beginning, but of course, as you advance, okay, from the beginning, for instance, you start checking, do you have inverted or you have flat nipple? So you start checking for things like that. As the pregnancy advances, you notice, is my breast increasing in size? All of those are what you do. As in, as it advances to, you keep checking. And am I having that wrinkles I talked about? When you bathe, you clean the nipple, clean any debris that may gather there to clog the dots at the hair. So at every point, but more especially as you advance, at every point, and once you are registered for antenatal, you start caring and looking at for your breast. I will not give it a specific time.
All right, thank you for that. Yeah, so start from the beginning to prepare the breast for breastfeeding. Um, Asemota Omoshefe Loveth is saying, how can a mom that has already given birth pull out her nipples because it is flat and the baby is finding it difficult to grab?
Okay, so simple thing is there's nipple corrector.
Okay.
Sorry, let me see if I have one here. In case they are going out and looking for what does it look like, there are different types. This is a nipple corrector. Okay. Now you put it on. Where is my breast again? It's in my hand. So you put the nipple corrector on your breast, but you can also use your hand. The good thing about this size of nipple corrector, there's another longer one, is that you can wear it with your bra. Okay, you create negative pressure here, put it on the breast, and it will stay. You can wear it with your bra like that if you are really bad case. But alternatively, you can massage. Lubricate your hand, lubricate the breast. Just massage to try to pull it out. But if you can, they're all affordable. Just use it. You understand? Does that answer the question? So at any stage, whether you're still pregnant, of course, when you're pregnant, you have to be very careful though, the stimulation you stimulate the breast too. Because too much stimulation can lead to premature contraction, uterine contraction. And it will not get to that level, I beg. It won't get to that level. But just
All
know
right.
that.
All right. Thank you. This person's name is not showing. The Facebook user is saying, in a situation whereby a mother does have, I think there should be not, does not have enough breast milk, what will be the alternative for the baby?
Why do you not have enough breast milk? That's the first question I will answer. So in instances like that, you need to be talking to a specialist. Why is it that you do not have enough breast milk? So we have to explore the option, what is there first before we start. And it's not even in my position to begin to prescribe alternative for you. See your pediatrician. But if you meet me, I will ask, why are you not having enough? How many times are you breastfeeding baby in a day? In a 24-hour period, you should be putting the baby to breast on an average 12 to 16 times if you are counting. If you are not counting, what I love to hear is, I cannot count. There's so much I cannot count. I like to hear that kind of answer. But if you are counting 12 to 16 times in 24 hours, so you hear a mother who say, I'm putting my baby to breast 5 times. For where? 5 times. You are not demanding enough of that breast. Create enough demand. So we'll find out why are you not having enough breast milk, first of all, before we start talking about alternatives. So there's
Okay.
not a simple answer.
All right, I got that. Facebook user, I hope you heard her too. Bumi is asking, why do babies like to suck at night more than the day? Bumi sounds tired. Bumi, you must be tired. So sorry.
Why you don't like to
All
suck
right.
at night? We need to ask the babies, so why do people like to suck at night? You see, we suck on the, I think at night you are more conscious of the number of times they suck because you want to sleep. So you're counting how did they suck. But the beautiful thing about letting them suck at night is you produce more prolactin at night. Between the hours of 1 a.m. and 5 a.m., extra prolactin is produced. So take advantage of that extra prolactin that is produced by, so even if your baby is not waking up, I've seen mothers who say, "I thank God my baby does not wake up at night to feed." It's not enough, it's not right. Learn to, even if your baby is not going to wake up and express, because extra prolactin is produced at that time of the night. So wake up and express. That's why when you wake up as a mother, you notice that your breast is full in the morning. Sometimes their bed will be wet because the breast is not leaking. Extra prolactin is produced. So take advantage of that time and feed baby on demand. Feed and express and keep, if possible. So there's
All
nothing wrong
right.
there. Just
All right. Thank you. Another Facebook user is asking, how about after 2 weeks of delivery? I can still hand press. Can I still hand press my breast milk? I'm sure that's a question.
yes, and the expression is a method that you use anytime. In fact, there are people, I know of someone who said she does not use breast pump. If there's need for her to express, if her baby is not sucking directly, it is her hand that she uses. Within how many minutes she can fill a cup with using her hand to express. Okay, so you can. It's just that for me, as a nurse who support breastfeeding mothers, I find it super effective that initial time when it seems like there's nothing coming out of the breast. But any other time you can express. It's a method of expressing.
So Maureen Kelly Ugochachi is saying, which month is good to stop exclusive, man? No
It's not
ATP
it is
member should be
good.
asking this question. For real.
It's not
Nobody
that
here
it's
should be
good. It's
asking.
what's prescribed is 6 months, exclusive breastfeeding for
Ex-
6 months. You continue breastfeeding, no, but that's exclusive, only breast milk, no water for 6 months.
Maureen, we're going to fine you for this question. Except you just joined ATP this morning. All right. So moving on, Christy Falaye is saying, well done, Ma. Is it true that some people's milk is always sweet?
I don't know about always sweet too. You have to taste it to know. And I know normal breast milk is not. You cannot describe it as being sweet.
Exactly.
You can't
All
describe
right,
normal breast
that's
milk
fine.
as being sweet.
I Okay, so Maria Chizoram, I am guilty. I was in pain from CS. Thank God after 3 days we moved to exclusive. Well done, Maria. I also didn't have patience to baby carrying. I bought breast pump and baby gradually stopped sucking from the breast. I tried to put the pump off. Boom, engorgement. I was admitted for fever. I ran back to pump, but in all, I thank God. Excuse me. Um, In all, I thank God, and I told myself I must give her only breast milk for 6 months. I had more than enough milk. I stored in the freezer and fridge. That's what helped me do it for 6 months. I think we lost the rest of the comments, but well done, Maria. Emmy Ja is saying, "Thank you so much, ma'am. I wish I had this before my delivery. Oh, wow. It took me more than 2 hours before breastfeeding my baby. They even told me to bath first. My baby was bathed and dressed up before I started feeding. That will never happen again. Thank you. May Jehovah bless you for us. Please, how can I win my toddler without difficulty?" I think that's the word, yeah.
Mm. Okay, so there are different mothers. Maybe if you belong to a mother's group, what I would suggest to you, hear what other mothers have done that has worked for them. Okay, the people have different suggestions. Some they say they traveled, they just left before they came back, maybe didn't want again. There are different suggestions that people have given in terms of weaning off a toddler. So I think you should hear what other mothers, if you belong to ATP, throw it out there and hear what others are saying that has helped them.
Okay. Um, Thank you very much. Facebook user is saying, "I just concluded exclusive breastfeeding. I feel this lump like when I just started lactating. Should there be a cause for alarm?"
The lump is where? Where is the lump? Like when you just started lactating, so it's not the first time the lump is there now. Normally the breast has, I don't want to make the phone again, I shall tell you the lab. The breast has different lumps all over. When you palpate, you always see one lump or the other. So depends on where this lump we are talking about is located. If you are engorged, remember that you will feel some lumps under your arm in different parts of the breast. That's the kind of lump you are referring to. But to be on the safe side, you may just need to go to the hospital, let your doctor check.
All right. This is another question from Khadijat Adenike Karim. If you have cracked nipples and you are pumping with a breast pump and a little blood is in the milk, should it be discarded?
No, it shouldn't be discarded. If you are not pumping, baby was sucking directly. Would you know that there's blood in baby's mouth? Now you need to understand that there are different types of and I have this breast milk that I had that I saw it and I was shocked and like wow, is this the color of colostrum? I checked it out, it's called rusted milk syndrome, rusted breast syndrome. There's something rusted though in relation to breast. Sometimes a little bit of blood from the ruptured blood vessel or something gets mixed up with your breast milk. It does not make the breast contaminated, the breast milk contaminated. So I will not say discard. What quantity are you talking about? And you're not talking about 50 mils here. You're not talking about 100 mils of blood. Maybe something that is not even up to 0.1 mil in how many mils. We don't just throw breast milk away like that, so please.
All right. Thank you very much for that. Do we have another question? Okay. So Maria Chizorom says, "I stopped breastfeeding since 3 months, but when I press my breast now, milk still comes out. What will I do?"
There's nothing you can do unless you want to see a doctor to take something. But obviously, there's still prolactin in your body. That's why you're still producing breast milk.
Okay. All right. And this one from Blessing Paul. "Please, is it wrong to breastfeed a baby with just one breast? And can I give her the second breast after not sucking it for 2 months? My baby is 9 months old."
Okay, so try to take advantage of your two breasts at the same time. So don't overwork. You're shortchanging yourself. Let me use that word. If you keep breastfeeding baby with only one breast, because the two breasts has ability to produce equally according to the demand you make on them. So if you keep making demand on only one, you are making this one not to work for you. Okay, so try and make use of them. There's no reason why. Of course, sometimes we favor one more than the other due to position or one thing or the other. But just note that it is good that you express for both breasts. So even though you may like that position, but try intentionally make effort to make use of the other breast. And if after a while you still want to go back, there's nothing stopping you. You can always go back.
All right. Mathania FA says, is there any need to use lactation cookies to enhance breast milk?
So lactation cookies are not magical pills, because even with the lactation cookie, you still need to stimulate the breast. If you read the description from the lactation cookie, they tell you put baby to breast 8 to 10 times in a day. So if you want to use them, that's fine. People have testified to the fact that it has worked for them. But I do not just say first thing first, go and use lactation cookie. No. First thing first, put baby to breast. First thing first, why is breast milk not coming out? So we'll explore all of those options first. If you want to use it, that's for the decision is yours.
Okay. All right. All right. Thank you. Ihezwe Maureen Ugochinyere says, is it advisable to breastfeed a baby while lying by your side on the bed?
If you do it safely, yes, you can do it. That's why there's a method of breastfeeding called sideline position. You have to do it safely. Don't go and sleep on
Okay.
your baby.
Okay. All right.
Yeah.
Facebook user says, what causes one to have lump during lactation? After weaning the baby, the lump is still there. I think you just talked about this, the last two questions. Yeah. So we'll just move on. Amira Chris says, my baby refuses to suck feeding bottle. So if I express it to waste, how do I make her suck on a feeding bottle?
Okay. Okay, so bottle is not the only thing you can use to feed your baby. You can use cup. You can use spoon. You can explore all that method. Another thing is, even that bottle you are using, try another person feeding that baby. Give another person to feed with that bottle. So
Did you?
be creative, think out of the box, try different things. You can use syringe, you can use different things to feed the baby. You can use There are different things you can use to
Okay.
feed the baby, not only bottle. So try
Okay.
other means.
Thank you. All right. Omolade Salaudin says, does menstruation affect the quantity of breast milk produced?
To my knowledge, I don't think so.
Okay, that's fine. Thank you. Priska Kenneth says, at times I feel my baby is being overfed with breast milk because she sucks a lot.
Okay, so you have to understand when your baby is full. For some babies, as long as you put the breast in their mouth, they just keep sucking and sucking and sucking. You don't want to overfeed your baby. That's the truth. You don't want to underfeed. So
Okay.
it means you have to be super sensitive, super cautious of when is this baby full. Normally, they should remove it from their mouth once they are full. No, they give you sign that they are full. So could it be that baby is not getting enough? That's why she wants to suck, suck, suck. Or she's just the type who likes to eat, so she's sucking and sucking and sucking. But if they become overfed to that extent, may even vomit the food. You don't want to overfeed. The same way you don't want to underfeed your child. So watch out and understand when the child is full.
Okay, so thank you so much, ma'am. Like I said earlier, this has been a wonderful session, visualizing everything that you said. And to all our viewers, again, we have been speaking with Blessing Iwe, a pediatric nurse, a midwife, and a lactation specialist. Any last words from you, ma'am?
Okay, so the last one for me is breastfeeding is possible, because I go online and I hear a lot of people, we speak with the side of our mouth. We don't want to say it too much that we don't want to emphasize too much on breastfeeding so it does not look like we are guilt shaming those who have to use formula. We don't want to talk about it too much because people will give it the reason prepare what's it called, depression is real. Mothers become depressed in the name that they must, people force them that you must give breast milk, you must give breast milk, a whole lot of that. I mean, you hear it. So sometimes, even me that talk about breastfeeding a lot, I'm conscious of how I say it. So it doesn't look like I'm shaming other mothers who cannot do it. And I want to also say that the bandwagon that are against breastfeeding, there are more than those that are for breastfeeding. So don't think that your friend who is cheering you up there, I beg, give formula if you cannot give the breast milk. It may be for you. She may just be projecting what she wants on herself on you. So give it your best effort first. Give it your best effort first before you say you cannot do it. Today I got a message for someone. Usually I have this community of mothers I keep in touch with, and I send a message just to find out how they are doing. Somebody sent me a message. She's not the first person, but she said, we are doing well, oh, thank God. Oh, thank you for making me do this breastfeeding thing. I didn't plan to do it before. So because she got someone who always talk about, are you breastfeeding? Hope you are breastfeeding. Is there any problem? You can talk to me about it. So she has support team surrounding her. The people who are supporting her are more than the people who are not supporting her. She was able to do it. So surround yourself with people who speak the same language with you, so that you are not speaking with the side of your mouth when you say, I want to do exclusive breastfeeding. So that's the final thing I want to say. Surround yourself with people who all want to do the same exclusive with you.
All right. Thank you so much, Ma'am Rosemary Iwe. Thank you so much for your time on ATP. And to everyone who is viewing us, please, if you have further questions, you know the usual thing, post and someone will be there to respond. Also, this will be posted on the group, and you can always rewatch it. Don't forget, the breastfeeding week also continues tomorrow with a raffle draw for my breastfeeding story participants, and it's going to be the bomb with the CEO, Dr. Boyede Bemisola. Keep a date with us again tomorrow. Thank you so much, ma'am, and good evening, everyone. Bye bye from me.